My name is Lara and I'm presenting the topic Children Miseducation and Gender Dysphoria. So we begin with the questions. What is GD or gender dysphoria, and in what ways can the notion of gender dysphoria lead to children education or miseducation? In other words, when does children education stop and miseducation begin? And how is gender dysphoria conceptualized in the African point of view? Is gender dysphoria culture-bound? Is it a culture-bound syndrome that is restricted to the Western culture alone? Or do we have people with gender dysphoria in our society? First, what is the definition? Gender dysphoria is a condition that involves distress regarding one's sexed body and or associated social expectations. So the following are the basic things that we need to note concerning gender dysphoria. Gender dysphoria was originally identified as gender identity disorder, but in 2013, the American Psychiatric Association, in their 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, changed the category of gender identity disorder to gender dysphoria. So gender dysphoria has engaged a lot of professionals from diverse disciplines in a biopsychosocial-cultural debates. Now, inherent in tackling gender dysphoria are issues of ethical and social significance with focus on social identity, sex and reproduction, bodily integrity, and sex-based norms of expression and behavior. But when we bring gender dysphoria to the African world view, our societies have a special responsibility to safeguard the well-being of children. In Africa, where the communal way of raising children is gradually giving way to more westernized ideas, culture and ways of doing things are changing. What then is the treatment of gender dysphoria? But before we go to that, we must ask ourselves the question, do we have gender dysphoric people in Nigeria? Let's just streamline from the African worldview to the Nigerian setting. Do we have people like that? One, we cannot deny the fact that we have people that claim to be gender dysphoric, because we see them in our societies. They are not just the cross-dressers. That's just a minute symptom of GD. We have people that have changed their gender orientation, so they have gone deeper than just ordinary cross-dressing. What then is the treatment of gender dysphoria? We have the clinical treatment, which is known as gender affirming model of care, which includes the use of puberty blockers or PBs and cross-sex hormones, CSH, and surgeries. There are irreversible endocrine and surgical interventions which are massively invasive on minors with no physical pathology, that is, on healthy children's physical bodies. These interventions can carry a list of significant harms such as infertility or sterility, sexual dysfunction, impaired bone density accrual, adverse cognitive impacts, psychiatric disorders, surgical complications, cardiovascular disease and metabolic disorders, and also regret, which is psychological in nature. Now, gender affirming model of care as practiced in US clinics is characterized by a child-led process in which comprehensive mental health assessments are often minimized or omitted, and the patient's embodiment goals serve as a primary guide for treatment decisions. So a child normally comes and says, even though the sex has been assigned at birth that this is a boy or a girl. Let's take a boy, for instance. The boy just comes and he says, I don't think I'm a boy. I think I'm a girl. So I need to change to a girl. What do we do about that? So, what are the ethical issues in this scenario? One, the controversies surrounding the medical transition of minors are deeply cultural, with discourse dominated by intensely polarizing narratives. Let's look at the medical or clinical practice. Some view the medical transition of minors as a pressing civil rights issue. Do children have the rights to claim they want to transition? Others regard it as a profound medical failure and a sobering reminder that even modern medicine is vulnerable to serious error. And then who are those that are caught in the middle? We have children and their families who find themselves caught between competing perspectives. So what are the ethical issues again? One, we have the issue of reducing medicine to consumerism. Then we have the issue of the principle of anatomy. Does a child have the anatomy to say the right to say, I want a sex change? Then we should look at the issues of regret. Later on, we have people who have transitioned, who are now detransitioning because they have regret that they changed the normal course of their body. Then we have the issue of language appropriation, the understandable desire to avoid language that may cause discomfort to patients as, in some cases, given to modes of communication that lack scientific grounding. So these problems are actually very challenging. One, we cannot deny in Nigeria that we have people that claim to have GD. Is it really a psychological problem? And then should we look for other methods of treatment aside from gender affirming care? Thank you.
Well, I want to come in from. I wanted to ask the question you asked, you just raised whether the issue of gender affirming or gender dysphoria is psychological or medical or physiological. But I think I will leave that, and it's still a question that needs to be answered. It's not the issue of autonomy, the decision to transition from male to female or from female to male, whether it's an autonomous decision. So I also want to ask, can we say this is out of informed consent? Because your topic is talking about education, to bring a miseducation. Because when you educate wrongly, the person acts wrongly. When the person is rightly educated, you act rightly. That's what we presume. So when you look at the ethical principles used to in approaches to ethical reasoning, evaluation, look at one, the principle of autonomy, respect for persons, the principle of justice, the principle of beneficence, and other. But looking at that of that autonomy, which informed consent is the cornerstone there. Okay, so the decision to transition, can it be joined as an autonomous decision? Because one might be under undue inducement or influence, begin to dislike or feel uncomfortable with your gender, and you decide to change, and then tomorrow you also want to come back to that, and these raises issues. The people that have transitioned, are they the trans, are they going to use the use of restroom, or even the competition that is female only, and the men that transition to female is participating? We don't have the same physiology. Okay, the kind of strength. If you are playing football, for example, I say now I become a female and I'm playing. Is it fair to join me to play with the women, the natural, the biological women, and the transitioned woman? I become a transitioned man, or we get a different they participate in a different competition, those strands will be their own. Those that were formerly male and became female, one side. Those formerly female and now men, one side. The natural men, one side. Natural women, one side. But I don't know how we are going to address this kind of issue.
There are 2 points you raised there. You raised the point of the issue of consent. Now, there are children, most of the children that were transitioned in some of their medical facilities were transitioned at the age of 8 or 9 years of age. In that case, can we really say that the children are capable of fully understanding the procedures that they were going to undertake? Definitely the answer is no, they are not fully aware, because there are certain medical terms that that the medical practitioners refuse to use, so that these children can have a better understanding of some of the things that they are going to experience. But because of satisfying the bodily desire of the children, they go ahead, and the children definitely they give their consent without having a full understanding of what they are going into. The parents also give consent without having a full understanding of the procedures. There are instances whereby after several years, these children come back, this now definitely being adults, they come back and say, I don't think it's working. And if we look at the issue of gender dysphoria itself, it's encased in feelings, emotions, and not really on the medical aspect. Because if we are looking at the medical aspect, most of these children are actually healthy bodily, though not entirely in mind. So the focus should be on psychotherapy and other psychological treatment rather than medical. Then the second point you made about, for example, the transitioned people now engaging in sports with others who are actually assigned that same sex from birth. Now, that also is an issue, because early on in the early stage of their treatment, they are given PBS, puberty blockers. But even though they are giving these puberty blockers, they find out that the level of original component in them is not totally eradicated. So their strength still remains. A man who has transitioned into a female would naturally be stronger than a naturally born female. So it would be ethically wrong for them, for both of them to engage in a sporting activity together. So maybe we can say in this case, people that have transitioned should actually engage in sports with others that have transitioned, rather than engaging them in sporting activities with people of the sex assigned at birth.
The last conclusion is that at the end of the day, we have to legalize transgendered human beings. And so they will now have, that means gender something will now be male, female as transgendered. Well, I think in India they have, is it about 5 or 12 or 4 gender gender matters. But for me, I look at it this way. If you look at the foundation of it, you talk about it being psychological, based on feeling. I have the feeling that I should have been born a girl instead of a boy, and or I have the feeling that I should have been born a boy instead of a girl. Here, there's the aspect of culture, the foundation of culture. Does that will not happen in a culture? Let's not even talk about our own because they will say we are not technologically advanced. But countries like Russia, Israel, where they are, we can say in terms of technology, they are there, almost at par with the West, or if not having some edge over the West. You won't hear of such issues. Why is that? Because in those places, there is much of a holistic approach towards the development of the human being. So for me, this issue of transgender, based on psychology of feeling, of who I want to be, it's anchored on the ethics of self-autonomy. And then you'll find that the views of the likes of Richard Nozick will support that because he advocates for extreme individualism. And liberal democracy is based on that principle of individualism, self-autonomy, being the foundation of the human being. And so it means that if I have the feeling of what I want to be like, and there's the medical prowess to make me be that which I feel like being like, then the law allows it because it's my own self psychological state of mind. All right. So I think that's the main problem we have to address. Because there are other civilizations that they have this technology, but why is this sort of feeling or thinking not prominent among them? So I don't think it's the problem of technology. No, I think it is the problem of the ethical, political orientation of a country, whereby you allow individuals to achieve their psychological state of mind. They are free. There's liberalism. They are free ultimately to be what they want to be like. Maybe they feel like maybe you're supposed to be born a girl, not a boy. But and so there's a medical facilities to achieve that. So I go and queue behind it and get that done. The problem here is whether if I am born into a poor family and I have a feeling that I should have been born rich, I could transgender to become a rich person or transgender from a poor home to a rich home. Does that system provide for it? That's by the side. I'm just trying to diversify thought into some other perspectives. But the real problem is when you allow minors to fulfill their psychological feelings, psychological states of mind. That's where the problem lies. And here I would not like to say that it is the entire Western community and the community of the USA that's at fault. I think here that law is being manipulated. Because if you go into those countries, you discover that there is a particular age you are considered to be a minor. And there's a particular age you are considered to have attained the state of an adult. So I think here there is much of manipulation. And the manipulation strives on another matter, commercialization of medicine. That once a particular invention is in vogue, we must find a way of making sure we make money out of it. And this will go against what ethicists, Western ethicists like Kant, and a host of others had advocated against when they said that the human being should be treated as a kingdom of end. So the problem I have here is it that it is the spirit of liberalism that is in vogue, or is it that is in vogue in terms of making money out of medicine, or is it that really that individuals are being allowed to be who they want to be, and this being who I want to be is mostly among minors? This is a big problem that we have to look into. And if that is allowed to thrive under this mentality and madness of Japa, I think very soon the transgender will transport here. The transgender issue, if we are not careful, it will transport here.
Well, thank you, Prof. The trend is already coming here. But this topic is, what I'm saying is, I can say, is pregnant with meanings. We still need to explore this. We'll come back to this and then do another presentation on the more robust presentation. Then we'll get inputs from others. Now we have said we need to see how it manifests, look at even culturally, is it happening here? Was it happening in the past? Is it happening now? And look at the trend so that when we come now, we can make active contribution. So let's get your final words.
In conclusion, the CAS review of 2025 this year, which is a 4-year review from 2021, has answered a lot of questions. And some of these questions have actually caused some of these countries, Western countries, to take a closer look at the gender dysphoria regarding children and the medical interventions that they have been taking. So now some of these countries have revoked the order to transition minors, but they do allow adults from the age of 18 years to transition. So I believe that there are still issues we need to look at so that we can settle some of the challenging questions inherent in this problem. Thank you.